Obviously, outbreaks have existed for as long as we have. Epidemics and pandemics are part of the natural world. And over the last decade in particular, we've had some painful reminders of just how fragile modern human systems really are when disease spreads through interconnected populations. The West African Ebola outbreak, then the coronavirus pandemic. Now, with growing media coverage around the Hantavirus outbreak linked to the cruise ship, people are understandably getting nervous again. But the nervousness matters because outbreaks are not only biological events, they are psychological events, political events, cultural events, and above all else, human events. And I think this human part is where a major disconnect exists in how outbreaks and epidemics are managed. Epidemiologists, virologists, and public health experts are specialists in the behaviour of pathogens. They study things like transmission, incubation periods, lethality, infection curves, vectors, viral loads, reproduction rates, and case trends. Organizations like the World Health Organization, WHO, and the Centre for Disease Control and Prevention coordinate outbreak monitoring, detection systems, contact tracing, prevention strategies, public health guidance, and emergency response coordination. And all of that expertise matters enormously. But outbreaks, as I said, are not only about pathogens. They are about human beings reacting to fear and certainty about these pathogens. And humans under fear don't behave rationally, predictably, or consistently. Once a disease is perceived as both contagious and potentially lethal, the outbreak stops being purely medical. Fear itself becomes part of the outbreak, as we've seen many times. And fear spreads differently from viruses. Politicians often struggle during these types of outbreaks because they are balancing competing pressures. Overreact too early and they fear a backlash. React too slowly and they fear blame later down the line. Meanwhile, health systems are often dealing with limited resources, uncertainty, incomplete information, planning models designed for far smaller crises, and a coordination problem internally or with the governments. But even that isn't the deepest problem when it comes to outbreaks. The deeper problem is that outbreaks evolve through human behaviour, human fear, human trust, human culture, human belief systems, human perception. Those things shape human behaviour, and behaviour shapes outbreak dynamics. Take Ebola in Liberia, Sierra Leone, and Guinea a few years back. Public health messaging told people, if you develop symptoms, go to the treatment centres. But for many communities, the lived reality was this. People went into those centres and never came back out alive. That was what they perceived to be happening. And often, that perception wasn't entirely irrational given the lethality rates of Ebola. Ebola had extremely high lethality rates in some areas, especially in the earlier phases of outbreaks when systems were overwhelmed. So fear took hold. Strangers wearing huge yellow protective suits arrived in villages. Bodies disappeared. Traditional burial rituals were interrupted. Communities lost control over death itself. And eventually, distrust became so severe that in some cases, medical and aid workers were attacked and killed. Not because populations were irrational, but because they were terrified. Human beings interpret outbreaks emotionally, culturally, and socially, not only medically. And that distinction is extremely important when it comes to managing outbreaks. One of the biggest lessons from Ebola was that populations could not simply be treated as passive recipients of instructions. And eventually, some outbreak responses started to adapt to that reality. So instead of simply banning burial rituals outright, some responses began involving local religious leaders, trusted community figures, safer adapted rituals, supervised family participation, and clearer explanations about why certain protocols needed to exist. And compliance, as a result, improved because trust improved. That lesson should have fundamentally changed how we think about outbreak management, and because it was prior to the coronavirus pandemic. Because what ultimately improved compliance was not simply more enforcement or more medical expertise. It was understanding human behaviour, understanding their fear, understanding their dignity, understanding their cultural beliefs, and understanding what they were perceiving, not what the medical people thought that was happening. And yet, during COVID, many of the same problems appeared again in different forms. We hadn't learned the lesson. Public messaging around masks, for example, became inconsistent and confusing in many countries. At different stages, people were told masks were unnecessary, then masks were encouraged, then they were mandatory, while different countries applied completely different standards at the exact same time. And whether those changing recommendations were scientifically justified or not almost became secondary from a psychological perspective, because inconsistency damages trust. Once populations begin feeling that information is changing constantly, authorities are contradicting each other, or visible actions do not match public reassurances, people stop responding only to the medical reality or the science. They begin responding and processing emotionally. They begin filling in the gaps for themselves. They begin interpreting things for themselves. And that is when fear, rumour and polarisation start spreading faster than the pathogen itself. Right now, regarding the hantavirus, people are hearing hantavirus has low transmission risk, but they are also hearing it has high lethality. Then they read headlines about possible transmission on airplanes. Their threat systems struggle to reconcile those messages. So people fill in the gaps themselves. That's how fear spreads, and that fear spreads lightning fast. People also respond to what they see. If authorities say the risk is low, but simultaneously isolate ships, launch international tracing operations, and allow potentially exposed passengers onto flights without visible precautions like masks, people sense a contradiction. Whether the epidemiological risk is actually high or low almost becomes secondary psychologically, because uncertainty itself becomes the frightening thing. And to be clear, this is not a prediction that the current hantavirus outbreak will become another global pandemic. At the moment, current evidence still suggests limited transmission compared to diseases like COVID. But uncertainty is exactly when trust and communication matter the most, particularly at the beginning, because populations don't respond to statistical risk. They respond to whether systems appear coherent, transparent, and prepared. Outbreaks are also deeply political. Governments worry about economic damage, tourism collapse, public panic, elections, media narratives, and institutional legitimacy. Humanitarian organizations and health systems are not immune to those pressures either. Even during COVID, large organizations struggled internally with fragmented decision-making, conflicting priorities, communications concerns, operational disagreements, donor pressures, and fear-driven decision-making. And this is important because it explains why lessons are often only partially learned. Institutions improve technically. They improve logistics. They improve tracing systems, testing capacity, data collection, and emergency protocols. But they repeatedly underestimate fear, trust, symbolism, rumour, cultural dynamics, and human psychology under uncertainty. And human beings do not react to outbreaks like machines or like epidemiologists. They react emotionally, socially, culturally, collectively. So perhaps outbreak management needs to become more human, more transparent, more psychologically aware, more culturally adaptive. Not simply telling people, don't panic, but understanding why populations panic in the first place. People don't panic because they're irrational. People panic when uncertainty and contradictory information collide.